Welcome everybody to the Consortium of University for Global Health webinar, State of the World's Nursing and Midwifery Report, Strengthening Nursing Education, Employment, and Leadership. We know that nurses are, in fact, the backbone of health systems around the world. This year, the Year of the Nurse, the WHO released a seminal report on the topic of this webinar. It contains up-to-date data, information, and recommendations on how we can strengthen nursing around the world. We are very fortunate today to have three outstanding nurse leaders with us who are going to shed light on the report and what steps we need to take in the future to be able to move the report forward. The first speaker is Dr. Nancy Reynolds. Dr. Reynolds is the co-director of the WHO Collaborating Center for Nursing Information and Knowledge Management. She is also a co-author of the report. After Dr. Reynolds, Dr. Trish Davidson. Dr. Davidson will be speaking. She is the Dean of the School of Nursing at Johns Hopkins University. Then Dr. Sheila Talau will speak. She is the former Minister of Health from Botswana, co-chair of Nursing Now, and co-lead of this report. And finally, I'll make a few closing comments before we go to questions and answers. So it's my honor to introduce Dr. Reynolds, turn it over to her. Dr. Reynolds, thank you for joining us. Over to you.
Thank you so much. I'm really honored to be a part of this esteemed panel and so grateful to have the opportunity to provide an overview of the recently released State of the World Nursing Report. I was a member of the steering committee in my capacity as secretariat of the WHO network of collaborating centers in nursing and midwifery. The State of the World's Nursing Report was published by the World Health Organization in partnership with the International Council of Nurses and Nursing Now. It was released on April 7th on World Health Day. And it's really part of the planned actions that WHO had for 2020, which was declared as the International Year of the Nurse and Midwife. The report provides a very important overview of the research and program evidence on the contributions that nurses have already made and the potential contributions that they can make toward universal health coverage and the SDGs. It really, though, makes a very compelling case for a radical change in the way the nursing workforce needs to be educated, deployed, managed, and supported as part of a broader health workforce and health system policies. So it really calls for very significant investment in nursing education, jobs, and leadership. This report had its genesis really in several factors. A very key one of those being that Dr. Tedros believes that nurses are absolutely critical to meeting universal health coverage and the SDGs, and believes that they have great potential not only in delivering health care, but transforming health policies, promoting health in communities, and supporting patients and families in a variety of ways. The report also builds on several prior reports that have called for greater autonomy for nurses and increased recognition of their potential to impact health, expanded scopes of practice in clinical, education, research, and decision-making domains. And really a common theme across all of these reports is that greater investment in nursing will not only improve health, it will promote gender equity and support economic growth. Another key factor, and we'll be hearing from Professor Thu, who is a co-chair of the Nursing Now campaign, and she'll be discussing that, was also the great advocacy of Lord Nigel Crisp, who's not only a tireless advocate for global health, but he's become very invested in advocating for nursing. And a few quotes from him here: "The biggest thing we can do for health globally is to strengthen nursing." And he said, "This is the year of the nurse and midwife, not one that any of us had envisioned, but the COVID-19 outbreak is the most powerful demonstration of why we need to support, invest in our nursing workforce." And he said, "The greatest tragedy if we do not learn lessons from this pandemic." And certainly one of the lessons we're learning as we see nursing on the front lines is how important they are to meeting the challenges of the pandemic. But it's also highlighting many of the weaknesses that are shown in the State of the World Nursing Report. And the World Health Organization has commented nurses are on the front line fighting COVID-19, but an alarming failure in the global supply of protective clothing and new coronavirus tests, together with the unprecedented overwork linked to global staff shortages, has highlighted how vulnerable they are. So a little about the report. The report really provides information on several key indicators that were drawn from member states' national health workforce accounts, and it really provides the most comprehensive overview of the status of nursing across the globe to date. And really the thinking was that we really needed this strong data to drive investment in nursing. The report really provides very strong evidence on how the nursing workforce will help to deliver universal health coverage and the Sustainable Development Goals, and it provides a technical description of the nursing workforce in each of the member states, as well as making a number of policy recommendations. This is an example of just the sort of summary that the report provides for each member state. And just to provide a little bit of an overview of some of the cross-country data, we found that there are 27.9 million nurses, and 19 million of those are professional nurses. This suggests that there's a 6 million gap in the nursing workforce, and the gap is not surprisingly greatest in lower and middle income countries. The nursing workforce is largely female and relatively young. And nursing really is seen as being a highly gendered profession with associated biases in the workplace. And these continue to be, gender discrimination and inequality. For example, while nurses make up 59% of the health workforce, few of them are found in senior leadership positions in healthcare, and therefore are not often a part of important decision-making around healthcare. 70% of countries report having a chief nursing officer, but they don't have a budget or staff to support the CNO. The average years of education of nurses is 3 years, but we're seeing a global growth in the number of advanced practice nurses. 53% of those providing a response, a total of 78 countries, reported having advanced practice roles for nurses, which is incredibly important when we want to put nurses in strong primary healthcare positions. One nurse out of every 8 practices in a country other than the one where they were born or trained. And this, of course, accentuates a problem because it's often drawing from lower middle income countries towards higher income countries and leaving a greater deficit than what's already there. Mostly in the Americas and Europe, 10% of the current nursing workforce is due to retire in the next 10 years. And it's estimated that 36 million nurses will be needed by 2030. And to meet this target, the number of nursing graduates needs to increase by 8% per year. We also need to really improve the retention of qualified nurses. And this has become a big problem because of the amount of the poor working conditions for many nurses around the globe. So in short, the report shows that the nursing workforce is not growing where it's needed most, and that it's incredibly important for more, we have a large need for well-prepared, well-distributed nursing workforce. The report provides a number of important recommendations, and I won't go through these because I will pass over now to Dean Davidson. Thank you.
Thanks so much, Dr. Reynolds, for setting up
a great discussion about what should be the future directions for the nursing workforce. And as articulated in Dr. Reynolds' slide, we need to build on some of these key recommendations of the report. And as can be seen on this slide, one of the things that we need to address is just not an absolute shortage of nurses, but a relative shortage, and looking at distribution of the healthcare workforce. And we also know that nursing leadership and governance is going to be critical to building upon the recommendations of the State of the World's Nursing Report. And also the recommendations are overarching, and it's up to each and every one of us as nurses, as healthcare planners, as educators, to look at how we are going to really operationalize these key constructs and concepts. I think for me, my key takeaways is that the nursing workforce issue is inherently a political issue. Many of the issues identified by Dr. Reynolds in the previous presentation, such as the role of advanced practice nursing, we know that that is contentious and actively obstructed by many medical organisations in countries. And this is to the detriment of citizens who do not have access to primary health care. I think us as nurses, we really need to demonstrate our value proposition. And there are some great examples in the State of the World's Nursing Report that provide demonstration of our power to influence healthcare outcomes, move towards the Sustainable Development Goals, and work towards achieving universal healthcare coverage. What is a very important recommendation is that we know that the higher level of education of nurses is associated with higher health outcomes. We've seen in the midst of the COVID-19 pandemic that higher numbers of nurses per thousand population in countries, this higher ratio has led to a decrease in mortality. But perhaps what is more important in moving forward from this seminal milestone in the history of nursing is that we work to make sure that we have standard data definitions across the world. There's much more homogeneity in the roles, expectations, knowledge, skills and competencies of physicians across the world. But the term nurse can be pertained to someone who's had 6 weeks in a community college through to a doctorally prepared nurse. This report tells us that we have to invest in nursing. So this may mean that we need to reallocate resources from other areas to build upon this important workforce. And together as nurses, we need to address power. We need to make sure that we're engaged with political structures. And so it's such a great privilege to have Professor Sheila Tlou on this call, who has been a role model to many of us from her advocacy and work in HIV through to being the Minister of Health in Botswana, and also being an impetus for the Nursing Now campaign and the State of the World's Nursing Report. So this report really identifies an important stock take of where we're at. As nurses, healthcare policymakers, and citizens around the world, we all need to rally to make sure that we operationalise these important recommendations in the State of the World's Nursing Report. So thanks so much, and over to you, Professor Tlou.
Thank you very much, Dr. Davidson. It's Dr. Tlou is having a few technical problems, but hopefully she'll be on shortly. It's really a great honor to join the 3 nurse leaders in advancing what is absolutely critical to improving patient outcomes and addressing the health challenges before us. So I'm going to run through a few thoughts that relate to the report. The first one deals with the issue of nurses and the fact that nurses around the world are absolutely critically important to achieving the Sustainable Development Goals, not only Sustainable Development Goal 3, but quite a number of them. And in fact, if we cannot strengthen the nursing workforce, I would argue that we will not achieve the Sustainable Development Goals by the time the goals are due to be achieved. As we've heard before, we have a significant shortage of nurses. Right now, well, as of 2017, we have 5.9 million nurses, a deficit of 5.9 million nurses around the world. Now, 89% of those nurses are in low to low middle income countries. And as Dean Davidson said, there is also a problem in terms of distribution. So where we're not seeing nurses, we not only have a problem of nurses in low middle income countries, but there's also an even greater acute challenge in terms of a deficit of nurses in rural areas in particular. And this definitely needs to be overcome. So educating nurses is part of the picture, but we also, apart from training them, we have to hire, retain, and sustain them and distribute them to where they need. That's why what part of the report was very clear that every country should have a plan for the training of nurses, a 5-year plan, a funded plan to train, retain, and sustain nurses. And as Dr. Davidson said, that training needs to be standardized and improved and strengthened. The other opportunity, of course, is to increase the opportunities for advanced practice training. And why this is important is particularly in rural areas where nurses are providing the lion's share of healthcare, it is absolutely critically important to increase access to advanced practice training. All of us who have worked in low resource settings know the quiet tragedy of millions of people around the world who have preventable causes, treatable causes that become much worse as a result of a lack of access to care, particularly advanced care that can be provided by nurses. So how can this happen? How can we achieve that goal? Well, if anybody is part of an academic institution, you probably have partnerships with other institutions around the world. Why not share your trainers? Why not build long-term collaborations to enable your faculty to help collaborate sensitively in a culturally appropriate manner to strengthen and train and retain faculty members within low resource settings? We can use existing partnerships that we already have across research opportunities where we're sending our students abroad, and leverage those partnerships to make sure that the lion's share of benefits go to our colleagues in LMICs. We can share our access to libraries, curricula, regulations, and standards. And also, speaking myself as a physician, we as physicians can be utilized to provide advanced practice training for nurses. This is an extraordinary opportunity that we can capitalize on. And also engage other disciplines, management and public administration. As I said before, training is part of the picture, but we have to hire, retain, and sustain nurses. And as Dean Davidson and Dr. Reynolds said, working conditions are not acceptable for a vast number of nurses around the world. So we have to work together, no matter what discipline you're in healthcare, to fight for minimum fair wages, quality infrastructure, pay equity, and safe working conditions. Interestingly enough, only 1/3 of the nations around the world have laws that protect healthcare workers. This is an opportunity to make sure that 100% of the nations of the world have laws that are enforced that protect healthcare workers. The other issue is poaching healthcare workers. High-income countries that poach healthcare workers from low to middle-income countries is absolutely unconscionable. You cannot stop somebody from going where they want, and neither should. But to actively poach healthcare workers from low resource settings is really unconscionable. So if a high-income country admits a nurse from a low and low middle-income country, I think they have a moral obligation to train, retain, and sustain 2 nurses in that country from where that nurse comes from. We can also share access to online continuing nursing education as part of the retention picture. And access to high-speed, reliable broadband internet is absolutely critically important. Finally, on the advocacy side, to affect change, we have to get political. Whether you invest or don't invest in nursing is at the end of the day a political choice. So we all need to get politically active, politically engaged, to be able to ensure that the recommendations in this report are actually achieved. One way to do this in terms of leadership is to ensure that every nation has an office of the Chief Nursing Officer in their Ministry of Health. This is critically important to ensure that nurses are part of the leadership in advancing a country's healthcare plans. We also need to work to strengthen public institutional capacity because no country in the world can actually have an effective public healthcare system without a strong public institutional capacity to do that. And finally, our end goal as healthcare professionals is better health outcomes, better patient care. And all of us, regardless of our profession, whether we are nurses, physicians, or other allied health professionals, we need to team up. We need to collaborate. We need to work together, advocate together, work together to be able to ensure that our healthcare professionals, our nursing colleagues are able to maximize their capability. And I think this, the Year of the Nurse, and the 200th anniversary of the birth of Florence Nightingale is an opportunity to do that. Now, I believe Dr. Thao is on board right now. I think you were able to resolve that. Dr. Thao, are you on right now?
I am very much on board.
Over to
yes,
you.
Yes, we're able to resolve
joining.
connectivity problems. Yes.
Thank you,
Yeah.
Dr. Thao.
Thank
Over
you
to
very
you.
much. Thank you very much. Let me greet my fellow panelists who I thought I'll join before, but you know, we've had quite a few problems here, but it's great to be on. So let me start by just greeting all the presenters who are here, as well as everybody who is participating, attending, and really the whole audience. So I'm greeting you, and I'm sending you greetings from my co-chair of the Nursing Now board, Lord Nigel Crisp, and of course the board members of the Nursing Now Global Campaign. I'll be able to say who those are. You know, we want to start by acknowledging the vital contributions of nurses and midwives who are right now in the front line of the response to COVID-19 and really being infected and affected. And to say that we are with you. We are aware of the courageous work that you are doing, but not at any more one time has the spotlight of the world been shown on nursing as it is right now. So we are with you. But this year has not been quite what we had planned for what Keith Martin talked about, the year of the nurse and the midwives. We had quite a lot of activities planned, but because of COVID-19, we've had to extend some of those. We didn't cancel them, but we have extended and postponed the events to 2021. So we have the events up to June 2021, especially regarding the Nightingale Challenge, which is what I'll be talking about. Now, I'm talking about Nursing Now, the global campaign. It really came about with the realization that, the world does not have a global nursing workforce commensurate with universal health coverage and the Sustainable Development Goal targets, especially in low and lower middle income countries. And I know later we'll be having the State of the World report, and we'll be able to really see what is going to be happening. So my co-chair, Lord Nigel Crisp, had worked together before as advocates and champions for human resources for health and for the Global Health Workforce Alliance. And remember, that one was dealing with Millennium Development Goals. So we knew that many countries, one of our sayings was that many countries will not achieve the MDGs mainly because of shortage of skilled health professionals. But the problem can be resolved through global collaboration in health worker education and training, and also good retention policies, as well as ethical recruitment of health personnel. I know Dr. Martin just talked about, ethical recruitment of health personnel, but that has to be accompanied by very good retention policies. So we are very much aware that even countries, lower middle income countries, they have to put conditions in place such that nurses and midwives do not have to then be forced, so to speak, to move to any one country for the so-called greener pastures. So with that concern and within the framework of sustainable development goals, we got together, Lord Nigel, Crisp and I, and quite a few members to really say, now with the sustainable development goals, we still are having that problem. So we got together with WHO, International Council of Midwives. Let's just go to the first slide. I'm fine with that. And ICN to be able to look at how we work together. And here I must acknowledge the work of the Bedet Trust, because it has always been at the forefront in funding all the International Council of Nurses training, especially leadership training. So the Nursing Now campaign 2020, as the slide is on, was launched globally in 2018 and run in collaboration with WHO and ICN and supported by the Bedet Trust. So it's really to improve global health by raising the status and profile of nursing, and just to make sure that they maximize their contribution in ensuring universal health care and universal health coverage. So the advocacy we knew was going to be by the nurses themselves, because they are really the people who are right there. And we knew that if properly deployed, valued and included in health decision making, we would be able to achieve universal health coverage. So, but we knew also that nurses are really the very ones that the people admire most, that the people trust most. So we knew that involvement of citizens, the nursing community, political leaders, especially ministers of public health and public service, had to be part and parcel of the campaign. So we went about, we formed that board, but really then went about ensuring that countries do that, and countries were able to work within their own countries and launch the Nursing Now groups. So it's still going on, but we have been able to cover more than 190 countries. So it's really been great. So let me have the second slide. I don't know if I am controlling them. All right. So we really feel that nursing now should really more be about developing nursing and midwifery workforce. In particular, we want to see more nurse-led clinics, more specialist nurses, and in fact, advanced practice nurses, because I am one of the very people who know that when the HIV epidemic was at its height in Botswana, and I was Minister of Health, it was the advanced practice nurses who were able to prescribe, to see the patients, follow them up at community level. And within 4 years, we had brought down mother-to-child transmission from 28% all the way to 8%. And it was really all in the hands of nurses, because we had very few doctors. So we want to see primary health care for services, and really nurses involved in health promotion and disease prevention. Now, we needed the evidence. If you are going to do anything, you need data to support any advocacy, because this is a movement, is an advocacy. And therefore, the State of the World Nursing Report was really that advocacy, where we needed the data to say what's happening at country level. I'll stop here because we are going to have the full report on the State of the World Nursing Report, by my colleague. So, but let me get to the next slide. The next slide. So apart from just ordinary advocacy, we knew we needed champions. So there's one of the champions, the Director General of the World Health Organization. The next slide is showing another champion. The next slide, please. Yeah, there's my favorite champion, who has shown how, you know, that we are saying, look, nurses who are well educated and supported can reduce poverty, lower HIV rates, and lead political change. And it has already been demonstrated. So let's go to the next slide. Okay, now for another tool that we are now using, which is really part and parcel of nursing now, is the Nightingale Challenge, which is a global, we launched it last year at the ICN conference. Lord Nigel Crisp and I launched it last year in Singapore, and it's really appealing to employers to say we want employers to be able to provide leadership and development training for young nurses and midwives during the whole of 2020. It has now been extended up to 2021. So it's an integral part of this, and it's part of raising the profile and status of nursing, but focusing on the next generation of nurses and midwives as leaders, as practitioners, and as advocates in healthcare. So next slide. Yeah, this is the ask of employers, that they should have a leadership development program. Any program, it can be mentoring, it can be academic leadership, and I'm here happy that this is universities, so that, I mean, universities are really the best when it comes to leadership training in terms of having courses, having mentorship, and all that. So it's really what to say, at least 20 nurses and midwives age 35 and under. And the progress as of now has been really great. We have thought we'd get maybe 10 to 15,000 nurses, but we have 29,000 nurses enrolled in 745 employers in 74 countries. Now, we're hoping that since we have extended the year of the nurse and midwives to June 2021, we're asking more countries to actually participate. For example, in my own continent, Africa, West and Central Africa is still left behind. So one of the things I will be doing will be to advocate, go to those countries as soon as the COVID epidemic is over, and really make sure that I meet with some of the ministers to ensure that they also participate in the Nightingale Challenge. So let's have the next slide, please. Yeah, and it's in conclusion, let me simply say that we live in a viral age, you know, and things will never be quite the same. So as an integral part of implementation of the nursing now, we simply have to say that nurses have to be properly qualified, and midwives, they should be properly qualified, and they should be able to lead health services. Otherwise, our own health services will not be able to survive. So armed with data from the State of the World Nursing Report and supported by the Nightingale Challenge, we should now be able to change, to measure, and to witness the evolution of the nursing process, the profession, as we claim our place as recognized leaders in healthcare, from community to bedside, all the way to the policy-making table. So the Nightingale Challenge under Nursing Now will continue to engage employers of nurses and midwives around the world in this very year of the nurse and the midwife, with the aim of creating a sustainable model to ensure continued collaboration and education of nurses and midwives. So thank you very much, and please accept as well as advocate for the Nightingale Challenge. And those are the contacts. Thank you.
Thank you very much, Dr. Tlau. That was a wonderful presentation. And I think I would like to we have a lot of questions coming in. And I'd like to just start off with one that captures what Helene and Sandeep and others are asking. And it gets to the root of the moving forward. So I'd like to ask each of you the same question, starting with Dr. Tlau, then Dr. Reynolds and Dean Davidson. So what needs to be done next to move this report forward? What are your top couple of priorities in moving this report forward? Dr. Tlau, over to you.
Okay, having been a politician, This report, I mean, we want advocacy at the highest political level in each country. And the great part is that each country has its own profile. So what I'd like, what needs to be done is to actually synthesize, summarize this report. You see, politicians, I mean, I've been a politician, we don't read. So anything that's more than, say, 4 pages, forget it. So it should be synthesized into 4 pages and be given to the ministers as well as the members of parliament, so that they can be able to then, you know, integrate it and see what can be done at that level. So it's really that it needs to now, it's now the time for advocacy, but we need to find ways of advocating in such a way that we have to be effective. Thank you.
Thanks, Dr. Lau. I empathize. Dr. Reynolds.
Yeah, I absolutely agree that we need to have, you know, governmental buy-in and really a very strong intersectoral buy-in and support for the report. We don't want this just to sit on people, you know, on bookshelves. We really want action. I know WHO is planning policy dialogues with every member state to the greatest extent possible to really engage the government as well as various stakeholders. And Keith, you know, a few things. I think we really need more interprofessional buy-in. I think lots of people just see this as a nursing issue, and nurses end up talking to each other about how important it is. But I think we've really learned in healthcare and global that so many of our challenges are so complex, and we really need an interprofessional team approach, and nurses are a key member of that team who really don't get adequate support and you know, and investment in really being everything they can be to be a strong part of the team. And I'll stop there.
Thanks, Dr. Reynolds. Dean Davidson.
So I just want to sort of build on the excellent comments of the previous speakers. I really think this report and the Nursing Now campaign lays the foundations for truly demonstrating our value proposition. All too often for administrators and policy members, nursing is looked at as a budget line item. So people will say to me, well, nurses are 80% of the workforce budget. And I say that's because they do 80% of the work. And I think we need to really ride the wave of COVID-19, because as our previous presenters have said, this has really demonstrated that nursing is valuable. We need to make sure that that there is adequate staffing. And we know, for example, in nursing homes, which sometimes are often a misnomer because there are very few actually licensed nurses in those premises, that we have to make sure that everybody understands what a nurse is. And also in the context of CUGH and also the webinar, I would really like to see moving forward a bigger voice for academic nursing, for health science and practice partnerships. As Dr. Reynolds identified, this is a team effort, a multidisciplinary effort. But also, I think even though the chief nursing officers of the member states are very important, inherently they are political appointments often. And I really think the academy and organisations such as CUGH can present data, challenge stereotypes, and move people to more data-driven decisions. But we have to do this skillfully, because it's not just about the data. Very early in my career, I learned that one letter from a constituent to a member of parliament was more valuable than a New England Journal of Medicine publication in terms of shifting their attitudes and actions. I think we need to embrace the political, and we need to clone Professor Tlu and have many more nurses in high office. And I think the State of the World's Nursing Report, fueled by Nursing Now, is our starting point, and it's up to each and every one of us to move this agenda forward.
Thank you very much, Dean Davidson. Indeed, advocacy is a heart of moving things forward and implementation. And along those lines,
Yeah.
Dr.
Can I chime in?
Yes, Dr.
Yeah,
Chilo.
this is Sheila. Let me chime in after that, because she stated something really important. I think the CUG, you say CUGH needs to do some follow up and find out where the chief nursing officer is. What what do they do? And what are the challenges and how can they be here? Because what I found is that in a lot of countries, it's just this one person, and sometimes she's not even occupying a higher position. So, I mean, if she's one within a whole Ministry of Health, what do you think she can do? Not much. So it should not be just a one person. It should be a whole office that is supported by other high-level nurses. Now, when I became a minister, a lot of the nurses really I was under pressure, because the position of chief nursing officer had long been abolished, and therefore I was under pressure. You are one of us, put it on. I had to meet with the senior nurses and tell them, look, if we ensure that we have this position on, any other position within the ministry, we are going to be told nurses are taken care of. So let's just, within the ministry secretariat, we should aim for having a deputy permanent secretary who is a nurse, a director of research, who is, in fact, not just medical doctors, but other people. So we had to look even into the qualifications for recruitment. For example, where you say a master's degree in public health, but they would have the advert saying a junior degree in medicine. We had to change that and say no, it's a master's degree in public health. And with that, we were able to actually have more nurses recruited into the ministry. And that's the only time then I said, now we are ready to have a chief nursing officer with an office who can then be able to work with colleagues and be able to have that influence. Yeah, thank you.
Wise words, indeed. As you mentioned, a nursing office, not just an officer, with the people that could not only be in ministries of health, but imagine if nurses were seated in public works, education, justice, not only in health, what power that would be. So Dr. Mellis, a leader in her own right, asks this question. I'm going to pose this one to Dean Davidson and Dr. Reynolds. The next one, Dr. Talau, is coming to you. Dr. Davidson, Dr. Reynolds, what can universities do to translate the recommendations in this report and remove the structural barriers that exist to nursing now and nurses being able to advance to be the best and most effective practitioners they can be? Dr. Davidson.
So I think that's an excellent point. And the data from many stellar scholars such as Linda Aiken from the University of Pennsylvania, there's multiple studies that showed that more educated nurses are, that's associated with better patient outcomes. And we know that education, and particularly within the context of global health, education is more than just learning facts. It's learning how to work in system. It's learning how to work in an interprofessional environment, which is a big emphasis of what many of us do. So I think education is all about empowerment. I would love to see that the minimal entry into nursing is at the baccalaureate program, that nursing becomes more of a protected title. Because people can't just go to community college for 6 weeks and come and hang out and say, I'm a physician. And similarly, we have to think long and hard about the importance of the title, because this is more than a professional turf war. And this is not about the guild. This is about nurses being the most trusted profession. So every poll all around the world, nurses are the most trusted profession. So we really have to cherish that title, value that responsibility, and make sure that people that we prepare as nurses are not just educated, but confident, competent, and credentialed to be able to take care of the patients that we serve.
Thank you, Dean Davidson. Dr. Reynolds, would you like to add something to that question before Dr. Tulu? I'll ask you a separate question.
Sure, I absolutely agree with you, Trish, and I'll just add on that I think it's incredibly important. There are a lot of the recommendations around how we need more nurses, we need more well-prepared nurses, but that doesn't just happen without well-prepared faculty. And there's a real faculty shortage in many schools of nursing, and they need to be as well prepared. And I really think there needs to be an opportunity for their professional development, which is often very difficult. I think nurses really want to develop as researchers. We need the evidence base that informs practice, but oftentimes faculty are so inundated with so many responsibilities, they don't always have the opportunity to grow as researchers and as scholars. And so I think universities need to provide opportunities for their growth in that manner. And I know at Johns Hopkins, we have a very active visiting scholars program where we have PhD students and faculty come and study at Hopkins. But in the COVID environment, some of those opportunities are going to become more constrained. So I think people having an opportunity for mentorship within universities is going to be very important, as well as taking advantage of the many now electronic opportunities. So I'll stop there.
Thank you, Dr. Reynolds. Dr. Tlau, this question concerns advanced practice training in low-income countries and the obstacles that that nursing faces in accessing advanced practice training. Can you share with us what is needed to actually ensure that more nurses in low and middle income countries have access to advanced practice training?
I wonder what would be interfering with the access, in the sense that, like, I can only talk about Botswana in this case, where advanced practice, the family nurse practitioner was part and parcel of nursing education and training. And indeed, when we started the bachelor's degree program, they were part of the ones who were able to come in for the master's. So we are able to have faculty as well as administrators from that very crop. And not only that, we were actually educating nurses from Botswana, Lesotho, Swaziland, Zimbabwe, Zambia, Malawi. We had the nurse leaders in some of these current countries, or their proteges were actually educated in Botswana. So we've never really had a problem. The problem that I'm seeing now has been the problem of lack of faculty. But it's actually a problem of the mind, because a lot of my own students have actually retired. You meet somebody who has a PhD who says to you, oh, well, I retired last year. Why? Because I had reached age 60. And you're thinking, what? So, if these people should be, I've said that to the minister to say, bring them back. Those are the cream of the crop. They have PhDs and they're just loitering. And you're telling me because there is a government regulation. You know how men, when they make rules and regulations, oh, okay, I don't mind, let me not stereotype, but that rule and regulation of you are over 60. And therefore we have a shortage. We shouldn't be having that. So that for me, there is really no problem with accessing. You'd need a scholarship, yes, for training, because nursing education and midwifery education are very expensive. But really, it will be a scholarship just like the way countries provide scholarships. So, but I want to also emphasize really the value of collaboration, the value of having visiting professors. Once COVID is over, we can be able to do that. So somebody like me, I've retired being a regional director of UNAIDS, but there is no reason why I can't go to your Johns Hopkins for a semester and be able to teach. So it's just really a question of even changing our own mindset to say, what is it that we can use that we have so that we can really educate the new generation of nurses and midwives?
Thank you,
Thank
Dr. Lowe. And I'm going to ask this one again to you, Dr. Lowe, because it's a WHO-specific question. And the question is, should there be chief nursing officers in the regional offices of the WHO? Dr. Tlau.
I don't know who removed them. I'm saying they should be, because you know what, they were there before. I have no idea who removed them. But then maybe it's because WHO, the regional offices, guess who is there? Is medical doctors who may not be understanding what it is. So that's where we need another advocacy, because definitely if you have somebody in the regional office, they are then able to liaise. Like right now, the regional office for Africa, guess how many countries they are dealing with? So that person with his or her colleagues, so that it's just not one person is in office, they're able to advocate. And believe me, it sounds at country level, sometimes it sounds better when it comes from a UN family system than anywhere else. Even when I was minister, if I thought of something that was really from my brain and I knew it wouldn't fly, guess what I would say to my president? And WHO thinks so too. Sometimes I had not even consulted them. So it flew because it came from an international organization. So we need those people there. Yeah.
Thank you, Dr. Lowe. I'm going to ask two quick questions, one to Dr. Reynolds, Dr. Davidson, then we're going to have a wrap up, 1 minute from each of our speakers. Dr. Reynolds, this comes from Rochelle, a professor in the Philippines and others. She wants to know what we can do to have a safer working environment for nurses.
Well, yeah, and this is, again, gets back to some of my points about, we really need this intersectoral buy-in, and as Dean Davidson commented on, we often don't see the investment going into nursing. Nursing's seen as a cost, and we're always seeing as a way of saving costs by cutting back and expecting nurses to do more and more and more. And it's just not appropriate. It drives nurses then out of the profession. In some countries, the nurses only stay in for 2 years, and they have this wealth of knowledge and skills to bring to healthcare. So I do think there need to be some very concrete things done, and we really, across all domains, have to start breaking down some of the hierarchies. And certainly gender is a huge one that we need to work on. And I don't know, Trish, if you have anything to add to that. But.
Yes. So I think those points are absolutely right. And I think the feminization of and how we're presented in the media is a real barrier. That feminization does not respect our male colleagues. And also, I think, sort of potentiate stereotypes as nurses being assistants rather than being autonomous practitioners. In terms of safe working environments, I think the nursing deaths due to COVID-19 are just heartbreaking all around the world. And we need to look at better data, as Dr. Toulouse spoke about. We need better workforce data. In most countries, at least in countries with robust health systems, if you're a fall and die on a building site, there is a coronial inquiry. And I think we need to make sure this happens to our colleagues. And then the other thing that has been really emerging from the COVID-19 pandemic has been this potentiation of violence against health workers. And this is just not related to nurses, but our physician colleagues and others as well. So we need to do a lot from a systems-wide approach to make sure this happens. But data is a great place. Physicians for Human Rights are doing a great job in trying to stocktake these large number of health professional deaths. And so it's up to us individually individually. We need to speak to our nursing regulators, and if someone, and people should be reporting workplace-related deaths, and these should be investigated. Because in some systems where nurses are not valued, they're not provided adequate access. In the midst of the COVID-19 pandemic, I'm really proud to say that Johns Hopkins health system has not had any healthcare worker-related deaths. But this is not the case, particularly in smaller systems without robust infrastructure for monitoring. So I think not just in the context of COVID-19, but I think health worker safety is something that is really a new phenomenon in global health and something that we need to take seriously. The Red Cross and the Red Crescent used to be a sign of no-go. Now, unfortunately, in some parts of the world, health workers are a target. So this is a complex discussion, but it's up to us individually and collectively to make sure we have robust systems for our colleagues.
Those are sobering words, Dr. Davidson. Indeed, it's a global tragedy that hundreds of our colleagues have perished around the world due to COVID-19. We're getting to the top of the hour, but I think we have time for last-minute words from each of you. And I'm just going to reverse, and Dr. Tlau, if you have any final comments, then Dr. Reynolds, then Dean Davidson. Dr. Tlau, any final words from you?
Just a short one to just say, look, we live in a new viral age, and without properly qualified nurses and midwives, our healthcare services will not survive. And it's not just for lower middle income countries, but for all countries in the world. So we need to therefore be able to collaborate to ensure that we educate nurses as leaders in healthcare. And to me, that is really the most impactful thing we can do to improve health globally. So that's all I'll say.
Thank you, Dr. Tlau. Dr. Reynolds.
Yeah, and I'll just reiterate, as we said several times, I just think the investment in nursing is so critical. I think it's unconscionable that we've had nurses on the front lines without adequate preparation. PPE, I think that you would never see, at least in the US, military being sent into a situation without appropriate gear. And I think this is a time where we just have to have greater investment in nursing and appreciate the value that it has to bring to healthcare globally, if we are to achieve universal healthcare and move toward achieving the SDGs. Thank you.
Thank you, Dr. Reynolds. Dean Davidson.
So thank you so much. And thank you to my colleagues on this panel. It's been inspiring in thinking about moving forward. Some of the points that I would like to make is just underscoring the role of partnerships that are respectful and collaborative. I really take on Professor Tlu's point that we're living in a new viral age, and one of the gratifying aspects of the COVID-19 pandemic has been really tipping some of the balance of power and knowledge. It's been phenomenal to see how effective that countries such as Rwanda and Ethiopia have been in containing COVID-19, and largely because of effective healthcare workers, and many of them are nurses. So I think we need to be sort of really own our knowledge, own our power, and own our contributions. And I do want to, again, make a call for the role of universities in society as thought leaders of challenging stereotypes, of being able to advance new knowledge. And I think one of the great thing that would be good to see in the State of the World's Nursing Report 2.0 would be greater evidence of more robust academic clinical partnerships throughout the world. So thank you so much for the opportunity.
Thank you very much, Dean Davidson. On behalf of CUGH, I'd like to thank all of the three wonderful speakers, nurse leaders we've heard today, Professor Sheila Tlau, Dr. Nancy Reynolds, and Dean Trish Davidson. We've heard a powerful series of presentations on taking this WHO report, the seminal report, and advancing and strengthening and implementing the recommendations within it to fill the gaps in the nursing profession, to strengthen the nursing profession, and to establish effective partnerships amongst different healthcare professionals to advance the goals within the report. Again, I'd like to thank you for joining us today. Thank our wonderful speakers. Thank Jenna Smith, who produces these webinars here at CUGH. And please know that this webinar will be up on CUGH's website, cugh.org, and it's widely available and can be shared with anybody. Thank you for joining us today, and we look forward to seeing you next time at another Consortium of Universities for Global Health webinar.
Thank you very much.
Thank
Thank
you.
Let's have another one. Thank you.